Center Test Prep Exam Book 2018. Question 1. The most common cause of airway obstruction in an unconscious patient is option A, laryngospasm, option B, foreign body aspiration, option C, the tongue, option D, mucosal edema. The correct answer is option C, the tongue. In an unconscious patient, loss of muscle tone allows the tongue to fall posteriorly and obstruct the airway. The jaw thrust or head tilt forward/chin lift maneuver is the initial intervention. Question 2. A patient presents with tearing chest pain radiating to the back. Blood pressure in the right arm is 190 forward/100 mm Hg and in the left arm is 130 forward/80 mm Hg. The chest X-ray shows a widened mediastinum. The nurse suspects option A, acute myocardial infarction, option B, thoracic aortic dissection, option C, pulmonary embolism, option D, tension pneumothorax. The correct answer is option B, thoracic aortic dissection. The combination of tearing pain, blood pressure differential between arms, and widened mediastinum on chest X-ray is the classic presentation of a thoracic aortic dissection. Question 3. A trauma patient with significant blood loss is in decompensated hemorrhagic shock. Which finding would the nurse expect to see last, as a very late sign? Option A, tachycardia, option B, narrowed pulse pressure, option C, hypotension, option D, tachypnea. The correct answer is option C, hypotension. Hypotension is a late and ominous sign of shock in trauma, especially in young, otherwise healthy patients. Compensatory mechanisms, tachycardia, vasoconstriction, can maintain blood pressure until 30 to 40% of blood volume is lost. Question 4. The hallmark sign of compartment syndrome is option A, pain relieved by elevation, option B, pain out of proportion to the injury, option C, absent pulse in the affected extremity, option D, pitting edema. The correct answer is option B, pain out of proportion to the injury. Pain that is severe, unrelenting, and disproportionate to the physical exam findings is the classic early sign of compartment syndrome. Pain with passive stretch of the muscle is also characteristic. Pulselessness is a late and ominous finding. Question 5. The initial fluid resuscitation bolus for a patient in septic shock, for surviving sepsis campaign guidelines, is option A, 250 ml of 0.9% normal saline, option B, 500 ml of D5W, option C, at least 30 ml /kilogram of isotonic crystalloid, option D, packed red blood cells to achieve a hemoglobin of 10 g/dl. The correct answer is option C, at least 30 ml /kilogram of isotonic crystalloid. Current guidelines recommend an initial bolus of at least 30 ml /kilogram of 4-isotonic crystalloid solution, for example, normal saline or lactated ringers, for patients with sepsis-induced hypoperfusion or septic shock. Question 6. The classic triad of symptoms for a ruptured abdominal aortic aneurysm, AAA, includes option A, hypertension, bradycardia, headache, option B, abdominal pain, hypotension, and a pulsatile mass, option C, fever, chills, flank pain, option D, dysuria, frequency, urgency. The correct answer is option B, abdominal pain, hypotension, and a pulsatile mass. The classic triad is abdominal or back pain, hypotension, and a palpable pulsatile abdominal mass. However, the triad is present in only a minority of patients. Question 7. Lefort fractures are classifications of fractures of the option A, mandible, option B, midface and maxilla, option C, barbit, option D, nasal bones. The correct answer is option B, midface and maxilla. Lefort fractures are a classification system for fractures of the midface involving the maxilla and surrounding structures. Lefort I involves the maxilla, Lefort II is a pyramidal fracture, and Lefort III is craniofacial disjunction. Question 8. Which type of shock is characterized by decreased cardiac output, elevated systemic vascular resistance, SVR, and jugular venous distension? Option A, hypovolemic shock, Option B, distributive shock. Option C, cardiogenic shock. Option D, neurogenic shock. The correct answer is option C, cardiogenic shock. In cardiogenic shock, the pump fails, leading to decreased cardiac output. The compensatory vasoconstriction increases SVR, cool, clammy skin, and preload backs up, causing JVD and pulmonary edema. Question 9. A patient with acute pancreatitis should have which nursing intervention as a priority? Option A, encourage early ambulation. Option B, keep the patient NPO and provide aggressive for fluid resuscitation. Option C, administer high-fat diet. Option D, restrict all 4 fluids. The correct answer is option B, keep the patient NPO and provide aggressive for fluid resuscitation. Initial management of acute pancreatitis includes bowel rest, NPO, to reduce pancreatic stimulation and aggressive for fluid resuscitation to prevent hypovolemia and maintain pancreatic perfusion. Question 10. A patient presents to the emergency department with a laceration that requires sutures. During the procedure, the patient states they feel faint. The nurse's first action is to: Option A, administer oxygen. Option B, place the patient in Trendelenburg position. Option C, immediately discontinue the procedure. Option D, assess vital signs. The correct answer is option C, immediately discontinue the procedure. The nurse should instruct the provider to immediately stop the procedure to reduce vagal stimulation and prevent syncope. After the procedure is stopped, the patient can be placed supine and assessed. Question 11. The most common cause of lower gastrointestinal bleeding in adults is: Option A, gastric ulcer. Option B, diverticulosis. Option C, esophageal varices. Option D, Mallory-Weiss tear. The correct answer is option B, diverticulosis. Diverticulosis is the most common cause of lower GI bleeding in adults. Upper GI bleeding is most commonly caused by peptic ulcer disease. Question 12. A patient presents with a painful, red eye, cloudy cornea, fixed mid-dilated pupil, and increased intraocular pressure. The nurse suspects: Option A, open-angle glaucoma. Option B, acute angle closure glaucoma. Option C, conjunctivitis. Option D, uveitis. The correct answer is option B, acute angle closure glaucoma. The presentation is classic for acute angle closure glaucoma, an ophthalmologic emergency. The sudden rise in intraocular pressure causes eye pain, cloudy, steamy cornea, a fixed mid-dilated pupil, and requires immediate treatment. Question 13. A high femur involves: Option A, retinal detachment. Option B, blood in the anterior chamber of the eye. Option C, ruptured globe. Option D, corneal laceration. The correct answer is option B, blood in the anterior chamber of the eye. A high femur is a collection of blood in the anterior chamber of the eye, usually from blunt trauma. The patient is at risk for rebleeding and elevated intraocular pressure. Question 14. The emergency nurse is caring for a patient with suspected pericardial tamponade. Which triad of findings, Beck's triad, is most consistent with this diagnosis? Option A, fever, chest pain, friction rub. Option B, hypotension, muffled heart sounds, distended neck veins. Option C, hypertension, bounding pulses, headache. Option D, dyspnea, crackles, pink frothy sputum. The correct answer is option B, hypotension, muffled heart sounds, distended neck veins. Beck's triad consists of hypotension, from decreased cardiac output, muffled heart sounds, from fluid in the pericardial sac, and jugular venous distension, from impaired venous return. Question 15. A patient with a history of renal calculi presents with severe flank pain, nausea, and hematuria. The priority intervention is: Option A, forcing oral fluids. Option B, straining all urine. Option C, pain management. Option D, surgical consultation. The correct answer is option C, pain management. While all are appropriate interventions, severe pain from renal colic is excruciating and requires prompt, aggressive pain management as the initial priority. Question 16. A patient sustains a laceration and has not had a tetanus vaccine in 12 years. The wound is clean and minor. The nurse should anticipate. Option A. No tetanus prophylaxis needed. Option B. Tetanus immunoglobulin only. Option C. TDP or TD booster. Option D. Tetanus toxoid and tetanus immunoglobulin. The correct answer is option C. TDP or TD booster. For a clean, minor wound and a vaccination history of more than 10 years since the last dose, a TDP or TD booster is indicated. Tetanus immunoglobulin is for patients with unknown or incomplete vaccination history and contaminated wounds. Question 17. A drowning victim who was submerged in cold water has a higher potential for successful resuscitation because: Option A. Cold water causes coronary artery dilation. Option B. Hypothermia decreases metabolic demand and provides neuroprotection. Option C. Cold water flushes the lungs of bacteria. Option D. The mammalian diving reflex eliminates the need for CPR. The correct answer is option B. Hypothermia decreases metabolic demand and provides neuroprotection. The protective effects of hypothermia reduce cerebral metabolic rate and oxygen demand, which can allow for survival and neurological recovery even after prolonged submersion. Question 18. A patient presents with costovertebral angle tenderness, fever, chills, and dysuria. The nurse suspects: Option A. Cystitis. Option B. Pyelonephritis. Option C. Nephrolithiasis. Option D. Renal artery stenosis. The correct answer is option B. Pyelonephritis. Pyelonephritis is an upper urinary tract infection characterized by systemic symptoms, fever, chills, and CVA tenderness, distinguishing it from lower tract cystitis. Question 19. The golden hour for acute ischemic stroke refers to the window for: Option A. Completion of an MRI. Option B. Administration of 4 thrombolytics, TPA. Option C. Achievement of blood pressure control. Option D. Initiation of physical therapy. The correct answer is option B. Administration of 4 thrombolytics, TPA. The golden hour in stroke care refers to the critical importance of rapid assessment and treatment. For TPA is generally indicated within 3-4.5 hours of symptom onset in eligible patients. Question 20. Carbon monoxide poisoning leads to hypoxia primarily by: Option A. Causing bronchospasm. Option B. Binding to hemoglobin with higher affinity than oxygen. Option C. Destroying lung parenchyma. Option D. Causing pulmonary edema. The correct answer is option B. Binding to hemoglobin with higher affinity than oxygen. Carbon monoxide has an affinity for hemoglobin 200 to 250 times greater than oxygen. By binding to hemoglobin, it forms carboxyhemoglobin, reducing the blood's oxygen carrying capacity. Question 21. A patient presents with substernal chest pain radiating to the left arm, diaphoresis, and nausea. The ECG shows ST segment elevation in leads 2, 3, and AVF. Which coronary artery is most likely occluded? Option A. Left anterior descending artery. Option B. Left circumflex artery. Option C. Right coronary artery. Option D. Left main coronary artery. The correct answer is option C. Right coronary artery. ST elevation in leads 2, 3, and AVF indicates an inferior wall myocardial infarction. The right coronary artery, RCA, typically supplies the inferior wall of the left ventricle in the majority of patients. Question 22. Hepatitis is primarily transmitted via: Option A. Blood and body fluids. Option B. Fecal-oral route. Option C. Sexual contact. Option D. Contaminated needles. The correct answer is option B. Fecal-oral route. Hepatitis is transmitted primarily through the fecal-oral route, often through contaminated food or water. Hepatitis B, C, and D are bloodborne. Question 23. A 25-year-old female presents with sudden, severe unilateral lower abdominal pain and vaginal spotting. She has an IUD. The nurse's priority is: Option A. Obtain a urine pregnancy test. Option B. Administer pain medication. Option C. Prepare for pelvic exam only. Option D. Discharge with follow-up. The correct answer is option A. Obtain a urine pregnancy test. The presentation suggests a possible ruptured ectopic pregnancy, which is a life-threatening emergency. A pregnancy test is the critical first step. An IUD increases the risk of ectopic pregnancy if conception occurs. Question 24. A patient experiencing a tonic-clonic seizure is in the emergency department. What is the priority intervention? Option A. Restrain the patient firmly. Option B. Insert a bite block. Option C. Maintain airway and administer benzodiazepines as ordered. Option D. Obtain a stat CT scan. The correct answer is option C. Maintain airway and administer benzodiazepines as ordered. The priorities during an active seizure are airway management, positioning, suctioning, oxygenation, and pharmacological termination with a benzodiazepine, for example, lorazepam. Restraints and bite blocks can cause injury. Question 25. The antidote for acetaminophen overdoses. Option F. Naloxone. Option B. N-acetylcysteine. Option C. Flumazenil. Option D. Sodium bicarbonate. The correct answer is option B. N-acetylcysteine. N-acetylcysteine, NAC, replenishes glutathione stores in the liver, allowing for the safe metabolism of the toxic acetaminophen metabolite NAPCHI. It is most effective within 8 to 10 hours of ingestion.